because I went to you a couple weeks ago, and you're present.
Yeah.
You know, you come in at me, square in the eyes, and you ask me questions. I have never had a doctor look me square in the eyes and ask me questions, ever, except for you.
Yeah, thanks. Well, I had to work hard to get that training, because our tendency is to go, I'm thinking about the laundry list, or the...
Just right to the TV screen or the, you know, computer screen.
That's all they look at.
A two-way relationship doesn't foster an open patient-doctor relationship,
I
period.
just had a patient who was fired because she violated her pain contract after the first visit. And, you know, I posted on Facebook about this. I said, she didn't violate the pain contract. The pain contract violated her. You know, you can't say you have a pain contract after one visit with someone and not adjust their medications, expect them to take a third of what they were taking and then just get through it and not even think about it. There are people who have variable abilities to take pain medications or to have the medications work for them. I just discovered recently that there's a genetic test for people who are rapid metabolizers of opiates, and it's remarkable the variability in human beings about who responds to what. So I had that kidney stone I told you about, and that was 1989. I had a kidney stone for 31 days this year. Unfortunately, I had some leftover Percocet that I loaned to a patient. That was a whole issue. But I only used 3 Percocet in 31 days, and it's because I kind of knew what was happening. Oh, there's my old friend kidney stone. And I just got through it. And there's more things available that are non-opiate for that. I was taking Kava and Flomax and ibuprofen and Toradol. And I got through that knowing pretty certain I had a stone, and also knowing that I didn't have the time to do all the Folderol I did, 20 years ago. So same mechanism, completely different response in me, different human being now, more capable of being with an upset or something that I knew was there. I think that points to anxiety. A lot of us are anxious, and we're anxious for good reason. We're being managed from scarcity. Well, what does scarcity make you do when you manage something? We learned that from it makes you hoard. Okay? And the whole idea is to prevent diversion. Well, here's a model for you. This is just a hypothesis. If you're going to hoard medicines because they're scarce, that means if you have a good day, you're going to hang on to your pills. So from time to time, you're going to have a surplus. And say somebody in your family has an injury, and that person needs something, and you give them a pain pill, all of a sudden, you're diverting. And because you don't have any guarantees that you're going to get enough if you were to actually tell the doctor that, yeah, my pain's a 5, it's not a 9.
You have to say 8.
You have to say 8, yeah.
It's the magic number.
Yeah. it's so there you go. So you're hoarding, which gives you a stash, which allows you to divert. So the process of diversion is actually generated by treating it scarcely. We don't treat alcohol scarcely, and there's alcoholics, and there's not alcoholics. And even in Prohibition, the consumption of alcohol went down for a couple of years till all the mills got going, and then it went right back up. And you manage it scarcely, and consumption actually increases. Go ahead.
That ties in with, it seems to me the fundamental problem is the laws, not allowing the freedom to deal with this in whatever way works. Lawmakers see kids or young people or whatever who have scored some hydrocodone or whatever on the street and got high on it because pain isn't their issue, and then crashed a car or whatever. And I think we need to educate them somehow that if you're in pain and take a narcotic, you don't get high. It goes to the pain. That's my experience, and I think that's a common one.
Yeah.
It goes to the pain, not to the high. If you take it and have no pain, you're going to get high. So the idea that the narcotics are to get high for pain people is wrong. That's not how it works. It goes to the pain. So that's an education thing for our lawmakers. And the other one is what I said before. If you cut us off, well, look out for your car stereo, because I'm coming for it, to hawk it, to buy black market stuff. It doesn't solve the problem. It
Well,
just
yeah.
pushes it into an illegal area.